Welcome back. This is the Dentist News Network. I'm Scott Drake. Regular professional cleaning or teeth scaling has been shown in a new study to actually prevent heart disease or heart attacks. My guest is Dr. Brian Harris with Harris Dental in Phoenix, Arizona. Dr. Harris, this study again shows that regular teeth cleaning or even occasional scaling by a professional has a profound effect on preventing heart disease.
Yes, it does. It's amazing how much the body, how much the body is affected by the mouth. The mouth is, believe it or not, carries a lot of bacteria, and those that keep their mouths clean and the bacteria levels low in the mouth have a lot less chance of allowing those bacteria to get into the body, which essentially can damage the heart.
Dr. Harris, this study involved 100,000 people over 7 years. And again, it showed a substantial reduction in the chance of heart disease with even one professional teeth cleaning treatment or scaling.
Definitely. I think if I remember right, it was like a 24% lower risk of heart attack and 13% lower risk of stroke. And that's huge. I mean, to know that you can decrease that risk of heart attack 24%, it's a pretty big difference and something that I think everybody should be aware of.
In your mind, what is the link between gum disease and heart disease, for example, or other diseases?
Well, the gums, underneath the gums, or the reason we get things professionally scaled, is the mouth itself is a dirty place, and underneath, inside the gums, there are a lot of different types of bacteria and some very dangerous bacteria. And so if those bacteria get into the bloodstream, that's when it can cause other serious heart issues, blood issues, and can affect the body in a number of different ways just because of the high level and the potency of those bacteria.
It seems logical that having your teeth periodically cleaned professionally is better than doing it yourself. I think the hygienist probably does a better job. Am I right?
That's correct, and that's the key, is actually getting down underneath the gum line, and that's what the hygienists do. So most dental offices will put their patients on a recall program based on how high the level of bacteria there are in their mouth. So if their mouths are fairly clean and healthy and there's not a lot of bacteria, maybe they're only seen once every 6 months. But those that are more susceptible to stroke and heart disease and other illnesses and have high levels of bacteria, they sometimes can be seen every 2 or 3 months. So it really just depends on the person and the health of their own mouth.
And in the long run, a regular cleaning treatment or scaling treatment will probably save you money.
Definitely. The more frequent you come, the better you take care of the teeth, the less decay we find, the less bacteria. Definitely a lot less issues in the long run. It's just like anything else. It's just a little maintenance along the way. It can prevent big disasters and can prevent things from getting worse and getting out of control.
My guest has been Dr. Brian Harris with Harris Dental in Phoenix, Arizona. I'm Scott Drake, and you're watching the Dentist News Network.